How does hip osteoarthritis differ from avascular necrosis? When discussing hip osteoarthritis and avascular necrosis, it is important to understand how these two conditions differ from each other. Both affect the hip joint, but their causes, symptoms, and treatments are quite distinct. Hip osteoarthritis is a degenerative joint disease. It occurs when the cartilage, which is the smooth tissue that cushions the ends of bones, gradually breaks down. This loss of cartilage leads to painful bone-on-bone contact, resulting in pain, stiffness, and limited mobility. Osteoarthritis typically develops slowly over the years. It can be caused by aging, wear and tear on the joints, or previous injuries. As the condition progresses, inflammation and structural changes in the joint can occur, further complicating the situation. On the other hand, avascular necrosis, also known as osteonecrosis, is a condition where bone tissue dies due to a lack of blood supply. This interruption in blood flow can happen due to trauma, such as a fracture or dislocation, long-term use of high-dose steroids, or excessive alcohol consumption. When blood flow is compromised, bone cells begin to die, which can lead to tiny fractures and eventual collapse of the bone structure. Avascular necrosis often affects younger adults, typically between the ages of 30 and 50, and it can progress more quickly than osteoarthritis. Both conditions cause hip pain, but the nature of that pain can differ. In osteoarthritis, pain usually worsens with activity and improves with rest. It is often accompanied by stiffness and a limited range of motion. In contrast, avascular necrosis may start with subtle pain that intensifies over time. This pain can occur even at rest or during the night and is often localized to the groin, thigh, or buttock. Diagnosing osteoarthritis typically involves a clinical examination and imaging studies that reveal joint space narrowing and bone spurs. Avascular necrosis, however, often requires advanced imaging techniques like magnetic resonance imaging to detect early changes in the bone and assess blood supply before any structural collapse occurs. The treatment approaches for these conditions also differ significantly. Managing osteoarthritis focuses on relieving symptoms through physical therapy, pain medications, lifestyle changes, and possibly joint replacement surgery in severe cases. In contrast, treating avascular necrosis aims to restore blood flow and prevent bone collapse. This may involve medications, reducing weight-bearing activities, or surgical options like core decompression or hip replacement in advanced cases. Understanding these differences is crucial for effective diagnosis and treatment. While both conditions can lead to hip joint damage and may require joint replacement, their underlying causes and progression are quite different. Recognizing these distinctions can help guide appropriate management and patient education. Always consult with healthcare professionals for personalized advice and treatment options.